Hello, everyone. This is Dr. Doug Endel with Atlas Rising, and today I want to give you a short, really practical breakdown of headaches. Headaches are one of those things that everyone has experienced, but not all headaches are the same. A tension headache is not the same as a migraine is not the same thing as a cervicogenic headache, and a sinus headache is not the same thing as a cluster headache. And if we don't understand the type of headache pattern that someone's dealing with, then we're usually just chasing symptoms, and that's not what we want to do. At Atlas Rising, our goal is not just to ask, how do we make the pain go away today? Of course we want relief. But the better question is, why does this keep happening? Because a headache is not just pain in your head. A headache is a signal. Your body is trying to tell you something, and the solution starts with figuring out what type of pattern your body is showing. So today I want to walk through the main types of headaches, what they commonly look like, and then spend most of our time with the approach to correcting the patterns that may be contributing to them. So let's dive in. The first type is tension type headaches. This is probably one that most people describe as a stress headache. It can feel like pressure, tightness, a band around the head. A lot of people feel it in the temples, across the forehead, into the back of the skull, through the neck and into the shoulders. This is the person who says, I carry all my stress in my neck. Or by the end of the day, my shoulders are up at my ears and my head is pounding. Or I keep clenching my jaw, but I don't know how to stop it. And with tension headaches, yes, stress can be part of it, but stress doesn't just live in your mind. Stress changes how you breathe. It changes how you hold your jaw. It changes your shoulder positions. It changes your muscle tone. It changes your posture. So when someone says it's just stress, I always want to go a little bit deeper with that. Where is that stress going in your body? For a lot of people, it's going into the jaw, the upper traps, the base of the skull, and into the neck. The second type of headache is cervicogenic headache. Cervicogenic basically means headache that's generated from the neck. And this is a big one in the office. This is the person who says, my headaches start at the base of the skull. Or it starts in the neck and then it wraps around the temples. Or I feel it behind one eye, but it seems connected to my neck somehow. Or if I sit at the computer too long, I know I'm going to get a headache. Those are big clues. The pain felt in the head, but that's not necessarily where the source may be coming from. It might be the joints, muscles, nerves, posture, the soft tissue around the neck, especially the upper cervical spine, so at the very base of the skull. That upper cervical area is a really important crossroads. This is where the skull meets the spine, and this is where the atlas and the axis sit. That area has a close relationship with posture, balance, muscle tone, and the nerves that can refer pain into the head and face. So if your headache starts in the neck, it worsens with posture, changes with movement, or comes with pain at the base of your skull, your neck definitely needs to be evaluated and not just guessed at. It needs to be looked at, not just jumping right into getting an adjustment. The third type of migraine, and this is important because migraine is not just a bad headache. A migraine is a neurological event. A migraine may include throbbing or pulsing. It's often one-sided, but it doesn't always have to be. It can also include nausea, vomiting, sensitivity to light, sensitivity to sound, sensitivity to smells, visual changes, dizziness, brain fog, neck pain, just feeling completely wiped out after having one. Some people get an aura before the migraine. They don't necessarily have to. And that can look like flashing lights, zigzaggy lines, blind spots, tingling, dizziness, all kinds of other sensory changes. And then some people have migraines without aura. Some have silent migraines, where they get migraine symptoms without the classic head pain. Some have vestibular migraines, where the pain symptoms might be dizziness, vertigo, motion sensitivity, feeling off balance. And that last one's really important. A lot of people don't realize that you can have migraine activity without a major headache. So when someone says, I don't really get migraines, but I get dizzy, nauseous, light sensitive, and just feel wiped out, I'm already thinking, okay, we need to consider a vestibular migraine pattern or silent migraine. The fourth type of headache is a sinus headache. A true sinus headache usually comes with sinus symptoms. So you're talking congestion, fever, nasal discharge, facial pressure, swelling, an infection type of symptoms. Many people think that they have sinus headaches, may actually be having migraines or referred pain from the neck. So if you keep calling them sinus headaches, but you also have light sensitivity, nausea, motion sensitivity, pain worsens with activity, it might be worth looking at something a little bit deeper. And then the fifth type of headache is called a cluster headache. These are less common, but they can be extremely intense. They often occur around one eye. They occur in cycles or clusters, which is where they get their name from. And they might involve tearing, nasal congestion, drooping of the eyelid. And these definitely need proper medical diagnosis and management because of their severity. So those are the main categories of headache that I want people to understand. We've got tension type headaches, cervicogenic, migraine, sinus, and cluster. Of course, there's more, but those are the main primary ones. And then vestibular migraines as a really important subcategory to those because especially for people with dizziness or vertigo symptoms, we want to consider that as well. So now that we've talked about the 5 or 6 main types of headaches that we would typically see in the office, now let's talk about some solutions. At Atlas Rising, we don't approach headaches by saying, here's the one thing that fixes all of these different types of headaches. That's not the way the body works. And that's not how we want to work. We want to look at the pattern. We ask, what is driving the person's symptoms? Is it an upper cervical misalignment? Is it posture? Is it muscle tension? Is it jaw clenching? Is it poor movement in the middle back? Is it inflammation? Is it nerve irritation? Is it stress load? Is it a migraine threshold issue? Is it dizziness related to the upper cervical spine or vestibular symptoms? And then once we understand that, then we start to build a plan around that person. The first tool that we use is upper cervical chiropractic care, specifically the Blair technique. And this is one of the most important parts of what we do. The Blair technique is very specific. It's gentle upper neck, upper cervical technique focused on correcting misalignments at the top of the spine, especially around what's called the atlas bone. This area sits just underneath the skull, and it can have a major influence on posture, balance, neck, tension, all kinds of nervous system functions. And what I love about the Blair technique is that it's not about force. It's about precision. We're not just twisting and cracking the neck. We're looking at specific misalignment pattern and correcting it as specifically as possible. And for headache patients, this can be huge because many headaches start from the base of the skull or involve irritation of the upper cervical region. The second tool that we use a lot is full spine chiropractic. So even though we specialize in the upper cervical care, we don't ignore the rest of the body. The neck lives on top of the middle back. The middle back connects to the rib cage. The shoulders connect to the neck. The back and pelvis affect posture. The feet are the foundation of all of it. And so we might use drop table adjustments. We might use instrument-based care with an arthrostem. We use gentle mobilization and adjusting. We'll do full spine adjusting when that's appropriate. But the goal is to restore proper and better movement and better alignment through the system, not just chase the area that hurts. The third tool that we'll use with a lot of people is called extremity adjusting. And so people don't always think about this necessarily with headaches, but the shoulders, the ribs, the jaw mechanics, and even feet can all play a big factor and can really make a big difference and matter a lot. If someone's shoulders are rounded forward, if the upper neck is locked up, if the rib cage isn't moving well, if the jaw is clenching, all of that can increase tension into the neck and head. So sometimes the headache is not just a neck problem, it's a whole posture and movement problem. And so that's why we also look at the fourth tool that we use, which is called Trigenics. which is a neuromuscular therapy. And this is one of my favorite tools because sometimes pain is not just about a joint being stuck. Sometimes the tissue is, or the way that the brain and muscles are communicating is a big factor. So after an injury, stress, repetitive posture, or long-term compensations, some of the muscles become overactive and some muscles underperform, and the body starts to get out of sync. Trigenics combines muscle activation, targeted stretching, breathing, and neurological input to help reset that communication. And for headaches patients, this can be really helpful when we're dealing with neck tension, shoulder tension, jaw-related patterns, posture problems, muscles that are just constantly guarding. The fifth tool that we use a lot is just posture and rehab. This is where a lot of people skip ahead, but this matters a lot. If your headache pattern is being triggered by sitting by a computer, looking down at the phone, driving, holding stress in your neck and shoulders, then we have to change what your body is doing all day. An adjustment can help restore the motion, reduce the irritation, but if your body goes right back into the same posture for 8 to 10 hours a day, we need to train the system differently. And so we work on neck mobility, deep neck flexor strength, shoulder positioning, thoracic mobility, breathing mechanics, simple movement resets that you can use through your day. And I want to be super clear here. Posture rehab is not just sit up straight. That advice is almost useless by itself. Better posture is about endurance, strength, mobility, breathing, and awareness of all of those. The sixth tool that we can certainly use with some people is addressing the jaw and clenching patterns. So this is a big one. So many people with headaches are clenching and they don't realize it. They might clench at night, they might clench it while working, they might clench while driving, while they're stressed. And this can refer pain to the temples, around the ears, behind the eyes, and they might clench when they're stressed. And that can refer pain to the temples, around the ears, behind the eyes, into the neck. And so we look at jaw tension, neck tension, and breathing together. Sometimes we need to work directly with those muscles. Sometimes we need to help the nervous system come out of that fight or flight pattern. And then the seventh tool is called PEMF. So PEMF stands for Pulsed Electromagnetic Field Therapy, and we use it to support circulation, reduce inflammation, and help those tissues recovery. This can be really helpful when somebody has chronic inflammation, joint irritation, or tissue healing that just needs extra support. So it's not the whole plan, but can be a really useful part of the plan. And the eighth tool that we'll use with people is called cold laser therapy. So cold laser uses low-level lights to support cellular healing and reduce inflammation. And we might use it for nerve irritation, soft tissue inflammation, joint pain, areas that are irritated and just need a little bit more support. So again, not a magic wand, just a tool that will combine with some of our other therapies and techniques. But when it's used at the right time for the right person, it can make a huge, huge difference. The ninth tool is custom orthotics, when we think that the foundation is part of the problem. So this probably won't apply to every headache patient, but it matters for some. If somebody has poor foot mechanics, collapsed arches, uneven weight distribution, or chronic postural compensation from the ground up, then this can affect the knees, hips, pelvis, spine, neck, and ultimately how the head sits on the body. So for some patients, we can scan the feet, look at whether custom orthotics could help create a better foundation for them. And then the last and 10th tool is really lifestyle and trigger support. And this is where we look at the bucket, right? So I talk a lot about your nervous system, has a capacity. Poor sleep fills the bucket. Stress fills the bucket. Dehydration fills the bucket. Blood sugar swings fill the bucket. Hormonal changes fill the bucket. Neck tension fills the bucket. Screen time fills the bucket. Food triggers fill the bucket. And then one more thing happens and the bucket starts to overflow. And that might be the migraine. That might be tension headache. That might be the flare-up. So we help people look at the hydration, sleep, meal timing, caffeine, alcohol, food triggers, stress patterns, breathing, exercises, daily movement. And the goal is not to make your life perfect. That's absolutely not realistic. But the goal is to lower the total load on your nervous system so that your body can become more resilient. That's really the solution. Not just one adjustment, not one stretch, not one supplement, not one therapy. The solution is identifying the pattern, matching the right tools to that pattern. For one person, the biggest missing piece may be an upper cervical correction. For another person, it might be jaw clenching and stress physiology. For another, it might be migraine triggers, sleep disruption. For another, it might be posture and mid-back mobility. For somebody else, it might be a combination of all of it. That's why our care is customized. So if you're listening to this and you deal with headaches, here's the question I want you to ask yourself. Where does the headache start? Does it start in the neck? Does it wrap around the head? Is it one-sided? Does it come with nausea, light sensitivity, dizziness, or visual symptoms? Does it happen after screen time? Does it happen after stress? Does it happen after poor sleep? Are you clenching your jaw? Are you relying on medication over and over just to get through the day? And maybe the biggest question, have you actually had the pattern evaluated? Or have you just been managing the pain and symptoms? Because those are two very different things. And at Atlas Rising, we work with people dealing with headaches, migraines, neck tension, dizziness, posture problems, pain patterns that have been going on for way too long. We look at the upper cervical spine. We look at the full spine. We look at posture. We look at muscles. We look at movement. We look at the nervous system load. And then we use the tools that fit your specific situation. Blair upper cervical care, chiropractic adjustments, Trigenics, extremity work, posture rehab, PEMF, cold laser, orthotics, and lifestyle support. So the goal is not just temporary relief. The goal is to help your body reset, realign, and start functioning better. Headaches might be common, but living around them is not normal. If you're tired of planning your life around headaches, migraines, neck tension, dizziness, we'd love to help you take a deeper look. Schedule a consultation with me, and we'll spend about 45 minutes to an hour to go through all of this in detail and make sure that we get to the bottom of what's going on so you can get back to living a life fully lived.